To do the balance beam. She's had diabetic neuropathy for about 26 years. We are going to give her a treatment today in one of her feet, and this will be our baseline tandem walking. So Margaret, do the best you can. Okay, I think that shows what we have, which shows the fact that the police would think you're drunk when you're not, especially if you had low sugar, so you'd be in double jeopardy. The patient has had a diabetic neuropathy for 26 years. She has, in 10 years into her diabetes, in 1991, she developed a Charcot foot with a fracture during exercise class due to lack of sensation. She also currently has enough lack of sensation that she can injure her toe walking and get bleeding and not know that it happens till later. Aside from her sensory issues, since her surgery, she's got a mild partial foot drop on the on the left. This manifests as slight toe weakness, which when people are barefoot does increase the risk of injury. So we will demonstrate that first on just the big toe. So this is her good foot, this is her right foot. I'm just going to try to press on it. She's going to try to keep me from pushing it down. So Margaret, are you ready? Mm-hmm. Okay, don't let me push your toe down. And as you can see, this would be considered very reasonable strength. Now, Margaret, I'm going to go to your left foot and try the same thing. Okay, she's got it. Try to keep it up and don't let me push it down. And you can see I can overcome that. So that's about a 3/5. Now we'll try to recruit the rest of the toes. So I'm just going to have her resist my pushing all her toes down. So on this right side, keep them all up. And don't let me push them down. Hard as you can. I feel like she's got a little weakness there, but not too bad. I think that'd be a 4/5. That's not totally normal. Now we're going to go on this side. Don't let me push it down. And then we're down to the 3/5 type. Again, maybe low 4/5 strength when she recruits them all. Sensation-wise, we really haven't checked her yet, but she does not do well with a tandem walk. We have a separate video of that. If she can, she's practiced doing standing with her feet together. She's done better with that, but the tandem walk is very abnormal. If I just touch her here, I want you to tell me, Margaret, if it ever changes or it all feels the same.
Gets stronger as you go up.
And tell me about where it gets stronger.
Right there.
All right, so she's got a pretty typical stocking neuropathy on the left. We go on the right.
Right there.
All right, and that's very symmetrical. All right, so we're going to give her a treatment on our left side because this toe is weak and we want to see if we can get that back. All right, so this was the foot that was weak with the pushing down of the toes. So keep your toes up against me as hard as you can. And I'm just going to do the big toe. Now you can see she can really fight me. And now I'm going to do all the toes. Let's try that. I'm doing all the toes. And she can hold them up. I can almost be feeling like I'm hanging off a cliff. Now we got this side, which is the side we have not treated, that was stronger. We're going to push, don't let me pull them down. And you can see they're no stronger than this side. And now we'll try together. It's a little hot, like I'm in your way.
Yeah, wait, no.
Maybe if I go from the top and I'll just push.
Yeah. Well, that'll be different. You put.
Yeah. I mean, just the concept. Yeah. I'm going to push her toes and see between the two. I'm telling you right now, I'm pushing just as hard, and there's no give. So that is a pretty good cure. And all we did was 1, 2, 3, 4, 5, 6 shots.
Amazing. Just amazing.
Okay, so the situation is she's going to walk better, but it's not going to be from that little change in her foot drop. She's going to walk better because her diabetic neuropathy is considerably better. She can now feel the floor. Prior to this, she worked with somebody 3 times a week for balance for years, and obviously that's all she got. One treatment, she's like this, and I think that's very impressive. Further apart. So you feel like you can feel some carpet fiber?
I never could feel it before. I couldn't keep my toes on the ground.
Yeah.
Like I used to try and do squats, and my feet are supposed to stay on the ground, balanced, but I always fall back.
Yeah?
And now I can do it, and my feet aren't falling. My toes are secure on the ground, so I can feel it in
Right.
place.
And what happens, you see, that allows your toes to curl into the carpet, which improves your balance.
Right, which I
Okay.
couldn't do before.
I think we have another winner.
Yay! So-
Well, here's a very happy patient who, after a very minimal couple minute of me giving her shots, has now had a full return of strength on her left toe. So we thought we'd just throw in the smile.
the smile,
No.
it's a
Okay,
miracle.
now.
So I know what you're thinking. You're going to say, well, this didn't last. Well, I only treated her the one time, and as you can see here, months later, she walks quite a bit better. The only thing I need to do more is actually I should treat her right foot, which was never treated, and I think she will walk considerably better. So this is a one-time treatment, never seen in medicine before. It occurred to us that we really hadn't done her right foot all this time. So we had her come back in last week, and as you can see, she's much better. Notice how she doesn't have to look at the floor when she walks.
I can feel the stability more right through here, and that's an area I always struggle with because I can't feel like that contact with the ground, and that kind of affects my balance. You know, one of my problems has always been like if I tried to do a squat or an exercise, my toes would come up because I didn't have the stability. So if I did a squat, I was going like that and I couldn't do it right. But now when I have stability with my feet, I can lean back and do it right. You know, so then I can actually use my muscles properly and get stronger. And, you know, to me, that's a big area I see it in.